Welcome everybody to Advisor Talk. I am your host, Frank LaRosa, and I'm very excited for today's conversation. Something that came out this week. It's something that's been on the minds of a lot of advisors in this day and age, as many advisors and our clients transition from the W-2 space to the independent space. And one of the key questions that comes up is, how do I handle all the benefits and healthcare and all those things? And I'm really pleased to have Chris Paulitz, who's the head of strategic initiatives for Financial Services Institute. Some of you may know it as FSI. And they rolled out something this week, which is just outstanding. And as soon as I saw it, I emailed Chris. I'm like, I need to have you on our podcast, and I need you to talk about this because this is a major thing in the industry that I need to do my part and get it out to everybody. So Chris, welcome to my show.
Right.
Thanks for jumping on in the last minute. I'm sure you're getting inundated with calls and everything. So
just a little bit.
Yeah. So this is great. Look, a lot of my listeners, I would say maybe half my listeners are in the W-2 space, right? The other half are independents, RAs, et cetera. So why don't we just start with getting into sort of your background and really who is FSI, right? Let's just start with the basics. So dial it down for a minute, and then we'll start with the basics and then get into the sort of the topic for today.
Sure. So my background is, as you can probably see behind me on the screen, I spent my first 11 years in DC as both a presidential appointee and as a Capitol Hill staffer and senior advisor. So my whole role was figuring out, right, what do people need and what do they need in the state? What do they need nationwide? And then going and fighting for that from the version that my bosses, my elected officials thought was the right way to handle it. So that's my background. So when I came into the trade association world about 12 years ago, I was doing the same thing, right? How do I help our member? How do I help FSI? How do I help our members get what they need beyond just our main member benefit, which is advocacy? So that gets into FSI. So FSI, the Financial Services Institute, was formed back in 2004. Our members are independent financial services firms and independent financial advisors. And some of those are also W-2 models as well. But the true thing for FSI is we represent the individual firms and the independent firms and independent advisors. Gotcha. So what we do is we advocate for them both on the state level and the federal level. That's what we do. And if some of you are thinking, I've heard FSI, but I can't place why I heard about them. We were one of the groups that led the federal lawsuit against the Department of Labor 4 or 5 years ago, and we won. We sued the Department of Labor. We won in court. They ruled their fiduciary rule was unconstitutional. And then we worked really hard to get SEC Reg BI in place instead. So that may be where they've heard of us if they can't quite place it. Great.
Okay. That's good. So that, I think, to my audience, it's important to understand. And candidly, it's a question that I asked Chris, because what we're going to be talking about today is very specific, and that is healthcare and other benefits that FSI and Chris has been able to put together, sort of in a group way, right? And you're going to go into that. I'm not an insurance person, but I am a business owner, and so I do have my own healthcare plan, and I go through this drill every single year with all my employees and contractors, and yes. Do we get healthcare as a group? Do we not? All those things. And that's a big question that a lot of our clients that go independent have. And that is, well, right now my firm pays for all of my healthcare, my dental and group health and group life and all that stuff. And, so when I go out, that's going to be really expensive, and I'm not sure if I can afford to do that. Yeah. And so, a group plan, or some people, which I think maybe you can get into how your plan differs than a PEO, for instance, right? So why don't we just sort of get into that and tell everybody about what you've recently rolled out. I guess you can go to advisorhealthplan.org for some of the information, and we'll give that to you guys at the end again. But just go into what it is that you recently rolled out, sort of the phase 2, and then maybe come back to phase 1.
Yeah, and I'm sorry, I want to take your direction on it, but I actually want to reverse the order a little bit so it makes more sense. So a year.
You're the guest. You can do what you want.
That's right. I taught all my elected officials in that, right? Don't answer the question you're asked. Answer the question you want to answer. So, so why don't we? But I think it would be helpful because people are going to hear group, and they're going to remember our plans that we unveiled over a year ago, and think they can't get in, and that's not true anymore.
Okay.
So this is technically a group plan, meaning they're joining a group, but it's our group. They're not joining as a group. So you could be an independent, you could be a sole practitioner and get in. So I just want to set that straight. So over a year ago, we announced our first foray into healthcare. And they were two different group plans. And we did our homework. We knew that most advisors had staff, right? So they would qualify. What we found out really quickly was most of those advisors who have staff, those staff are typically on their spouse's insurance,
right?
Which left that advisor as a sole practitioner for all intents and purposes when it comes to healthcare, because the federal government requires at least two people to get into a group healthcare plan. And even when they had 2 or 3 people to come in, they would have to be basically in perfect health to go through full medical underwriting and still see some kind of savings. And to find 3 or 4 advisors that are all in perfect health, it was hard to do. So we had tons of interest, very little that we could actually enroll. So very quickly last year, we started building out our own plan, a proprietary plan, not just going to a couple of insurance carriers and working out a deal. So what we've unveiled is a great plan. It is for individual advisors. It's actually for licensed staff too. So if you have a CRD number, you can enroll. And the way it works is you come in with your CRD number and you come in with a federal tax ID. Now, if you're a sole proprietor using a social security number, you can't use that. It's got to be something like an LLC. And you get your federal tax ID. We don't need to see revenues going through them or anything like that. We just need the tax ID number. And then they answer 10 medical questions, which are the big things, such as, do you have cancer or heart disease or AIDS? Something big like that will keep you out. But for 90 to 95% of people, they're going to get in because they don't have those big dreaded diseases or ailments. And that's a key factor. I'm not just going through the logistics, right? People, the biggest thing we hear so far is this seems too good to be true. How are you saving so much off of an open market plan or an Affordable Care Act ACA plan?
Right.
And the answer is simple. It's not from aggregating our 30,000 members. That's not what's driving the savings. It's the fact that we have health questions. So these plans are all ACA compliant. Every bit of them is ACA compliant. And when you're doing an individual plan, ACA allows you to do full medical underwriting. We're not even doing that. There's no parameds sent into your house. There's no med checks. It's just about 10 easy questions. It's an instant pass or fail on the website. But 5% of the country drives 95% of the healthcare costs. So by us saying, hey, we are gonna effectively keep those 5% out of the plan, our independent actuaries just lower those rates way down for the vast majority of people because they know, unlike the ACA that has to take everybody, regardless of their health, we're not. So that's why, the ACA was built as, healthy people are going to keep people who are sick afloat in those plans. Right. So we rarely get an email or a call from an advisor who's sick saying, I want better health care. They're comforted by the fact that they can go to the ACA, they're not asked any medical questions, and they're guaranteed coverage. This was built for those advisors the thousands of them for a decade who have emailed or called us and said, look, it's me, it's my wife, or it's me and my husband. Maybe there's 2 kids. We go to the doctors a couple times a year. We get sick, but we don't have anything dreaded. And we're paying more for our insurance every month than our mortgage. That's who this is built for. Relatively healthy advisors who don't have a dreaded disease or major ailment, who are sick and tired of paying so much money on the open market. That's who we built this plan for.
Okay. And so how do they, so that's great. So if you're, and what about if you're a business where you have multiple advisors?
Yeah.
Right. So you have a team. Yeah. There's 2 or 3 advisors. So let's take the scenario of there's 3 advisors and 2 staff.
Mm-hmm.
Right. How does that work? And if they're independent, if they're setting it up the right way, they each have their own individual LLCs. right? And then there's a S corp that owns the business, and they're all employees of the S corp, and that money flows to their LLCs. But that's a tax structure for another call.
And a lot are set up that way. And I can tell you, and obviously working in teams is a growing trend in the industry, no question. But not all of them are set up that way. So some of them will just have an LLC, and multiple advisors in that practice will be owners of that LLC. So what we're doing, whether it's an LLC or an S corp or a C corp, whatever they're in, if they are advisors in that practice, we are allowing them to share one tax ID as they come in. Okay. So they don't, if there's 5 advisors and there's one LLC, the other 4 don't have to go out and set up their own LLC. They can all share that. The only difference is for the staff. Now, non-registered staff that do not have a CRD number, they cannot get into this plan. We have plans in the coming year or so to start a true staff plan. But right now, one of the reasons why we're driving down rates, one of the reasons why this is available in all 50 states right off the bat, including California, New York, and all those states that they may be thinking, well, not my state. No, it really is your state, is because it is regulated by one state, and that's the North Carolina Department of Insurance. And they've approved it, and that means because it's technically self-insurance, it's available in all 50 states. But once you put a non-licensed staff member into that plan, that could create an ERISA situation or something for that practice that we don't want them to be in, because some states will say, okay, now you got to pay for parts of the insurance or part of their premium, or you have to administer COBRA if a staff member leaves. We don't want you in that position. So if you have licensed staff, they cannot share your tax ID as a practice. Only the advisors can. So if you're licensed staff, you come in with your own CRD and you come in with your own tax ID, and that's how you get in. And again, if the licensed staff they don't have a tax ID, go to the IRS website, go to something like LegalZoom, spend a few minutes, set one up, and then you're in. We don't care if they're 6 years old or if they're 6 hours old when they enroll in this healthcare. They just need the federal tax ID to get in.
Guys, so that would really, as I'm thinking about this, if I was an advisor, one of the conversations that comes up often for staff is this debate about having someone get registered or not get registered. This would really incentivize non-registered staff to get registered.
Okay.
Because
sure.
I mean, look, if their spouse has a corporate plan with some other company, maybe they're on that plan, so it's a little bit, it's a little bit different. But I can definitely see this being a good incentive for staff to get registered. So how is this different than a PEO plan? So one of the things that's becoming more popular in the independent space, I'll say becoming, but it is becoming more popular, is this drive to use a PEO plan, right? What's the difference between this and a PEO?
Yeah, no, the PEOs, will differ, but generally speaking, a PEO, the advisor goes onto a PEO, they're paying a fairly large annual fee, or they're paying a fairly large monthly fee to get on, with healthcare being one of a slew of benefits, right? It's typically not the focus. So they're getting, whether they want it or not, back office support and bookkeeping support and HR support and all this different stuff. And then they get healthcare too. And typically from the PEOs that I've seen, the healthcare savings, if there are any at all, are not very significant. So they're either the same as an open market plan, or maybe they're saving maybe they're saving some brokerage fee. So an advisor may be seeing 2% savings, 4% savings. We knew for the vast majority of our members, if we couldn't show them at least 20% savings, it just wasn't worth doing it, right? We needed for somebody to do something as personal as changing their health care, which, and I can explain this part of the plan. For us, this isn't an issue anymore, but it takes the advisor time to read about it so they fully understand, wow, I can go to any doctor at any time, right? But we know it's a personal decision. So for 2%, 4%, 5%, it's typically just not worth it. And it wasn't worth our time going through it and to bring that out to advisors. So what we're saying in our promotions is we're seeing savings up to 50%. And I can go through the ways we get there. But honestly, like there's some areas in the country, like the tri-state New York area, there's savings for some people that are encroaching 70%. It's a lot of it depends on zip code. So on the personal side of things, people say, hey, I like my doctor, I want to keep going. Can we still go to this doctor? And well, what's out of network? So my answer is there's nothing out of network at all. So the way our plan works is we have PHCS. It's PHCS. They are the largest doctors network in the entire country. And that's our national PPO. So if anybody wants to know if their doctor's in PHCS, you just Google search PHCS doctor lookup. And it's going to bring you to a site called Multiplan. And right on the homepage, you type in your doctor's name. I can tell you from my standpoint, and Frank, as you and I talked about, I've got 6 kids. So I was looking at my doctors, my wife's doctors, and my kids' doctors. My wife's doctor was in PHCS. My kids' doctors was in PHCS. So right off the bat, they're covered right there. My doctor was not. But there's no reason to worry about that, because the beauty of this plan is we use something called reference-based pricing. And that's run for a group called AMPS. It's all caps, AMPS. They're a nationwide company. They've been doing this for almost 2 decades. They're the leader in the country at reference-based pricing, which has been around for decades, and it's definitely a growing trend. And all reference-based pricing is a fancy way to say they pay a doctor what Medicare pays them, plus up to another 150%. So if you go to your doctor, you're going to have a really nice insurance card. There's going to be 2 things on the back. It's going to be a number for PHCS. So if they're in PHCS, doctor's office calls PHCS, gets their insurance number, plugs them into the system, they're in, just like any doctor visit, right, with the new insurance card. If they're not in PHCS, the doctor calls AMPS. The AMPS gives them the insurance ID number, and they're in. And the only difference with the AMPS side of things is the typical carrier takes a long time to pay a doctor. AMPS pays them 3/4 of the time faster than a big name carrier. So the doctor's not only getting the money they want, but they're getting it a heck of a lot faster using the open network. And what that really means is it doesn't matter what doctor you go to or what facility you end up at, or if you go to some facility for an MRI, something like that. Right. You could go to any of those things because it's either going to PHCS or an open network, and there's no higher price for the advisor to go to the open network. Another thing I would say is our carrier, which is Vault Strategies. Vault is both an insurance carrier. They have over 1 million people insured around the country, and they're also a captive owner and a captive insurance company manager. And just like most Fortune 500 companies, they have their employee plans inside a captive insurance company, and they are quote unquote self-insured. That's what most big companies do. That's what advisors are getting into. They're getting into a captive insurance company as a B-share owner. It's really simple. They sign one bit of paperwork and it's done. There's a personal business liability with that whatsoever to them, and they come in. So the way it works. So
that's really the significant difference, is that they're basically entering into a captive insurance group as a B-share owner.
Yes, that's the whole difference, right? They're coming in
self-insured.
Yeah, and again, this is the way almost all big Fortune 500 companies do it, because they don't need to go to a big name carrier with their eye-popping bonuses and their TV advertisement overhead, right? They create their own plan as a large company, and they stick it inside a captive, just like a lot of firms do for their E&O insurance, and they run the captive themselves, and they decide on their own, what's covered, what's not covered. We can let somebody get a big claim and that's okay. We can eat those costs. They make all those decisions themselves. And that's the beauty of what we're doing here. In fact, this is the only way to do this in this day and age. There's no such thing as a nationwide association health plan. It doesn't exist. Nobody has one. I don't care if there's marketing out there that says we do. No, you don't, because there's no insurance company in the country that's going to touch a nationwide AHP. And that's because the federal government or any state at any moment can just end a federal AHP. I'll give you an example. I won't say the name of the group, but about 2 years ago, when the Trump administration said, we're going to allow national AHPs with only one person in them, there were some groups that jumped on that, and they got thousands of people into the plan. And as soon as about 12 states sued in federal court, they had to shut down those plans, kick out all those people, and they were and they had a struggle to go get insurance somewhere else, like out of nowhere. And that is the beauty of our plan. It's not subject to those political winds like an association health plan is. We have started our own insurance company. It's all approved in one state, meaning no state can tell one of its citizens they can't self-insure. So they're coming in to ours, and they're in all 50 states. So that's one of the keys. The other key is what Vault is able to do is they've got long-time partnerships with these companies, like I mentioned, with AMPS and PHCS. Another one is Edison Health. So Edison Health has partnerships with Cleveland Clinic and Mayo Clinic. They were started by the founder of the Walmart plans, which everybody knows is famous. They do a great job, and they started this. Now, what they do is they have all these partnerships. So one of the benefits, just one, is let's say you are diagnosed with some dreaded, scary disease, like cancer or heart disease. They say you need an amputation or spinal surgery. Instead of just going with what your local doctor is saying you need to do, they will give you a free second opinion at a Mayo Clinic. And not only is the visit to Mayo free, they're going to pay for your airfare and they're going to pay for your hotel stay. So you go to Mayo, you get the second opinion, and then Mayo will say, this is what you need. And it may be the same thing your local doctor is saying, or they may say, no, they've got it completely wrong. So another cool thing about, not cool, it's actually scary, is what the Walmart data over 20, 30 years shows and what the Edison Health data is. For example, 40% of all cancer diagnoses are wrong. And you either don't have cancer at all, and they misread it, or they've got the stage of cancer you're in and the treatment plan completely wrong. 40%.
That's pretty scary. That's pretty
scary. And another thing is they will misdiagnose back surgeries all the time, right? I'm not saying they're doing it on purpose. I'm just saying they misdiagnose them all the time. So you come with a back problem that could just need some physical therapy, a trip to the chiropractor.
Yeah, I've had shed a few pounds. I've had the same thing.
Right. I mean, yeah, it could be any of that. And they're just saying, no, you got to go under the knife. And once you go under the knife, whether it's a transplant or an amputation or a spinal surgery, you are a patient for life of that doctor. You are a patient for life of that drug you are on. So having a free second opinion at a Mayo Clinic could change your life. It could change your life, and they get it free under our plan. So we have this whole myriad of partners put together that we think that just makes this plan revolutionary, and people are going to love it. But again, the key is go to any doctor, and it's either going to go under PHCS or it's going to go under our open network. And that's one of the beauties of coming into this plan.
So here's a question that probably people are thinking about as they're listening to this. So you're that person that went through that major issue, right? You had a major issue. You were, you made it through. What? And I know this is new, so maybe you don't have the answers to these questions yet. But what's the percentage of participants that will get dropped from this plan? And can you drop? For participants.
So I'm going to give you our answer that we talk about in private behind the scenes, and I'm going to give you my answer that I want everybody to follow. So behind the scenes, our carrier doesn't want to drop anybody, and their thought on this is, look, if somebody's in a car accident or they get some big debilitating thing that they get treatment for during the year and they've overcome it, then really in any insurance company's mind, that's a sunk cost. It's not a reoccurring cost because they've been healed, cured, in remission, that type of thing. Most of the time, we're going to let them stay in, no problem. Let's keep them in. I want to be much more conservative about that. So ACA compliance with a self-insured individual plan is we cannot kick somebody out mid-year. That's illegal. But when it comes back time for renewal, we could say to them, I'm sorry, you're racking up millions of dollars in claims. We can't renew you because you are going to start seriously driving the rates up for other members if you stay in the plan for years. So technically we are allowed to do that. And technically it can happen. I don't want to say it's slim to none. We just don't know. But the plan is to not take anybody out. What I can promise somebody is, if they come in or they come in with their spouse and their kids, and one of them has that happen to them, It would just be that one person who would go out of the plan. It wouldn't be the advisor, right? If it wasn't the advisor. Number two, they are going to know in plenty of time. So they are going to know by early November whether if something crazy happens and they're not renewed. And that way they'll have a full 2 months to go right back to the ACA open market plan or whatever they were on. So they're not going to find out with a couple of weeks and then have to scramble. We're going to give them plenty of time before they know. But again, our goal is that we're not going to kick anybody out, but technically and legally we can. And I just want to make sure people know that. Got it.
So, you said something about November, and open enrollment comes in at the end of every year. It's a period of time in my household that we not to say I dread it, because my wife handles it. She does a great job, but she knows when that time comes, she's going to be on the phone for 4 or 5 hours,
right?
Exploring
what's changing, wait
a minute. So you raise our premium again, but we're losing coverage. We're not really sure, and she's got to go through that matrix.
Yes,
call it like a matrix of what have you gained, what have you lost,
right.
Those kinds of things. So
we went through this ourselves. Sure.
Right. Yeah. With 6 kids, I bet you it's very
absolutely,
it's an important piece.
Yes, it is. And I should clarify, Frank. So there's no open enrollment period. So this plan's open all year long. The first effective date's April 1, but advisors can come and licensed staff can come in all year long. And the effective date is the first of every month. Now our renewal period, which is when our new rates will come out. Hopefully they haven't changed. And that I think is going to be one of the huge benefits of this plan, right? Because of the health questions, we do not expect any kind of big jump in premiums. So as our rates are staying low, the rest of the country continues to skyrocket, right? So that's going to be what we think is one of the beauties of our plan, the beautiful things of our plan. So, but there is no open enrollment period. It's all year long. Our renewal period will really start in November. So people will start to know in November, okay, have my rates changed at all for 1/1/2022? Okay. So that will be the renewal period.
Okay. What about one of the questions that came up with an advisor client that I'm working on now, and I had them already go to the site and all that, and I invited, I probably had 20 or 30 clients on the Zoom call that you all did. I guess it was last week. Last Thursday, you had like 2,000 people on it or something. Was
their biggest live event ever. So, and we're having another one this Thursday because I misled people. I said we're going to stay on this call until every question is answered.
Yeah.
And after an hour and 15 minutes, we still had about 500 questions that weren't answered. So we did not expect that size. So we are having another webinar this Thursday.
Yeah, I signed out after about an hour and a half. I was like, all right, I got to go.
It was a little crazy to say in a good way.
I recorded it, so we can go back to it. Yeah, I recorded it so I was able to reshare it with some folks. One of the questions, and maybe this will be again, we're getting a little bit long. I don't want to take up too much of your time because I know you're busy, but how does the service side of it work, right? So someone said, well, yeah, but the problem is it's like Obamacare. There's no one to talk to. Like you can't call anybody. There's no one to talk to. You basically go to the website and figure it out on your own.
Right.
How wrong or right is that?
It's wrong. So a couple of ways. Let's talk about as you're enrolling, and let's talk about afterwards. Yeah. So as you're enrolling, it's true. You cannot pick up a phone and call somebody because, again, we've had in 7 days, I want to say 10,000 people come to the site. We've had 5,000 people check their rates, and we've already had hundreds enroll, which is awesome. But that's a lot of people. There's not a call center in the country that's going to be able to handle that level of phone calls that come in. And like the ACA, you can't do anything, right? You've got to go on and just do it yourself. There's nobody. With us, you can live chat with a licensed insurance professional. So what they have to do is they come onto our homepage. Within seconds, they get their instant rates. That takes them to another screen. It shows them their 3 deductible levels, right? $2,500, $5,000, and $10,000 deductible levels. At the bottom of that page, there's a big blue button that says, click here to create an account. You're not locking yourself in. We're not going to share your information with anybody. That's right in the FSI laws. We're never going to do that. They create an account. As soon as they take that 30 seconds to create an account, a couple of things are going to happen. One, they're going to find one of the fanciest, most robust FAQ pages they can ever see. I mean, it's beautiful, it's searchable. The other thing too is they're going to see a purple circle pop up at the bottom of the page. That is a chat icon from 8 a.m. to 8 p.m. Eastern. They can click that purple circle and they can live chat almost any question they have with a licensed insurance professional. So is it a phone call? No. But can they sit there and type in any question they want? The only thing we're not going to give them advice on is tax advice, right? You need a tax ID to get in. That's all we're going to tell you. We're not going to tell you how to set something up. We're not going to tell you how to run your business. They're not CPAs. But when it comes to the plans, they're going to answer any question that you have. So right there, you can get all your questions answered. Once they're in, they're going to be able to, they're going to have their own portal in the AMPS website. If, let's say they probably one of the most common ones is they're going to call up the doctor's office and they're going to say, okay, we're not in PHCS. We don't know what AMPS is. We don't take this. And then they should say, okay, call this number. And almost all of them are going to say, fine, we'll call the number and everything's going to be fine. But some of them are going to go, well, we're not going to call the number. We just don't take this. Okay, that's when you call AMPS. And you can talk to a live person, normal business hours. You can ask them questions on a bill you got. You can ask them any of those questions. They will call the doctor's office for you. And they'll say, here's our insurance number, take it. And I don't want you to think this only happens on our program. I can tell you just a year ago, I had a sinus infection. So I go to our ENT. My insurance is through Blue Cross, but it's called in Virginia Healthy Blue. And for 15 minutes, that front office worker argued with me that they didn't take our insurance. And I'm sitting there thinking, do you see that symbol? It's Blue Cross. Well, no, we take Blue Cross, but we don't take this. And finally, I convinced her after 15 minutes, just call the number. So she said, okay, fine, I'll call it. And I went back and waited. 10 minutes later, so now we're 25 minutes into this thing, and I'm beyond the time I'm supposed to go into to the doctor. She says, oh, I'm sorry, we actually do take this insurance. Of course you do. It's Blue Cross. But so it happens even with big name care, right? So, but I would say, you know, just have them call the number. And if they won't call you, call AMPS, they'll call the doctor. But you can call AMPS for almost anything you want. If you have questions on your billing, if you have questions if something's covered, just give them a buzz and they'll tell you. If you have a doctor check question on PHCS, call them, they'll talk to you. It's just during the enrollment period, you can live chat with somebody, but there's just no way we could have a call center big enough for the level of volume and excitement we've got around this plan. It's impossible.
Okay, great. So, I mean, look, this has been a great conversation for me. It comes up often because, you know, we run an HR and payroll service for financial advisors, right? And one of the issues that we deal with is we don't provide healthcare, right? And so, you know, they have to either get it on their own or go through a PEO, which is pricier, and you're sort of like a dual employee of another company. So this was when you rolled this out, this was to me was awesome because it's been something that the industry's really needed and wanted for a long time. So so I appreciate your time.
Hey, Frank, if I can, I'd like to just tell you, your viewers too, it's not just healthcare, right? We started our covered advisor program 7 years ago, and now we are in the top 10 biggest group plans in the country. So if you're thinking about going independent, you're already independent, especially if you're thinking about going independent and you already have your healthcare paid for you, your long-term disability paid for you, your term life paid for you, and you're looking at a whopping, amount of money that you're going to have to start paying if you're going independent. Maybe it's $2-3 grand a month. We have all that for you at rates you can't find on the open market. So Frank gave you one website, that's advisorhealthplan.org. That's healthcare only. If you want to see healthcare and everything else, it's going to be an extra click for healthcare. Go to FSI, Frank Sam Independent benefits.com, FSIbenefits.com. When you get there, put in a generic special access code. It's all caps, FSI, the number 4, ME, so FSI for me, and you're going to get access to the healthcare, our group and individual long-term disability, our group term life and AD&D, critical illness and accident insurance. And I can tell you that group long-term disability especially, I don't care if an advisor sells insurance, they're not going to be able to touch it on the open market at all. It's probably going to be 1/8 of your costs.
Wow.
On what you pay on the open market. So It is seriously inexpensive. It's all through Prudential is our carrier. It's the best group term, long-term disability and term life plan on the market. And the rates, I mean, the money you're going to see with the healthcare, even if we can go up to $35,000 a month in income protection, even if you don't want that much, go protect your income somewhat, right? Use some of that savings, even if it's 50 or $100 a month, and protect that income because you don't know what's going to happen. We've already got 8,000 members into those plans. So if you haven't checked it out yet, really check it out.
It's the same thing. You need a CRD number and a tax tax.
You don't need a tax. Yes, it's basically the same thing, but you absolutely do need that CRD number to get in. Again, licensed staff can get in too. If you have unlicensed staff, we have a bundled package for them. So it's a bundle of up to $5,000 a month in long-term disability, short-term disability, which comes in handy all the time for things like maternity leave for your staff, and up to $50,000 in term life and AD&D. And we've got 2,000 staff advisors in that plan, even though we can't even market to them because we don't know who they are.
Right.
And most of those are being paid for by the advisor. They're paying for that benefit. So if there's no medical questions, there's no age banding, it's guaranteed issue for those staff. And what we're finding is advisors are always complaining, I have a horrible time recruiting quality staff. As soon as I recruit quality staff, they're taken away because they get benefits somewhere else.
Yep.
Now, if your staff is making 50 grand a year, that monthly premium's $43 a month. That's it. And instead of paying $199, which is the advisor dues at FSI, it's $49 a year for a staff member. You can go pay for that, give them a great benefits package, and start to retain and recruit those quality staff. So I definitely go to fsibenefits.com, use that special access code FSI for me, and check that stuff out too.
That's like a mic drop moment right there. Like, boom, you can get all that stuff. Like if you had a mic, drop the mic and walk out.
Get it all. We want you in for everything.
That would be great. Look, I gotta tell you, this is I talked to I don't know, hundreds of thousands of advisors, and so many of them don't know this. And so I really appreciate you coming on. I'm gonna try to get this out to as many advisors as we possibly can, and just get the word out that this is out there. So
we appreciate it.
I really appreciate this. Speaking on behalf of my clients, the financial advisors, we thank you for doing something like this. This is something that's been needed for a long time. It's really exciting. And I hope for my clients, and those of you that aren't my clients yet, you want to be my clients, great. But if those of you that are in the independent space and looking for something, you need to look out and reach out to Chris, not Chris, but go to the website and look into this, because there's substantial savings here. The benefits that they put together are tremendous. So with that said, thank you very much, Chris. I appreciate it. For my listeners, thanks for joining us. Don't forget to subscribe and smash that like button on iTunes, and go to our YouTube channel, Advisor Talk with Frank LaRosa, and we'll see you next time. Thanks a lot. Chris, thank you very much. Take care.
Everyone.
Bye-bye.
Thanks for watching Advisor Talk with Frank LaRosa. If you enjoyed this video, make sure to check out some of our other episodes. Don't forget to like, share, and subscribe to our channel, and we will see you back here next week.